I'm here with Dmitry Lvov, a professor from the Russian Academy of Medical Science here in Moscow. Back in 2004, he predicted a global pandemic would start with swine flu. Well, he's here with us here on RT. More than 150 dead in Mexico. Cases being reported worldwide. Is your prediction coming true?
I've been working on the issue of the new and reoccurring infections, including the ones associated with flu, for 40 years. 4 of my H5N1 bird flu forecasts have been fulfilled. However, I work with all the other flu virus emergencies which may arise anywhere on Earth at any time. It's hard to say whether or not we're seeing the beginning of a global pandemic. With modern means of transportation, it may take the virus mere hours to reach any area of the Earth, if the virus has pandemic potential. This potential, however, does not look evident to me at this moment. I think that it's highly possible, and if the process goes along this line, God only knows, the situation is going to be very bad.
14 million people die every year from various flu viruses, 30,000 here in Russia. Should we be more worried about this outbreak?
I wouldn't be surprised if we hear an hour later that someone became infected in any country of the world. The pandemic disease has been developing at the moment, which means the spread of the disease around the entire world. This process is extremely fast.
How similar is this particular virus to the Spanish flu, which killed millions back in 1918?
All flu viruses are associated with birds first of all. This connection between birds and the virus has been lasting perhaps for hundreds of millions of years. They've been circulating in nature's ecosystems for all this time independently from humans or pigs and other animals. However, these populations have been causing the infection outbreak on other species from time to time. As a result, such outbreaks may cause the so-called reassortation process, i.e. exchange of the virus genes which infect the cells of different animals simultaneously. This virus is more resistible, but I don't think it will have the same impact.
Why does the flu virus mutate so easily?
It's the exchange of genes. The virus genome is made of 8 bricks or segments of genes. If 2 different viruses reproduce in one cell, these segments of one genome can pass into the other one, producing a reassortant virus this way. This is exactly what has happened in the swine flu virus in the New World.
Why does this appear to be more dangerous?
The virus appears to be quite resistant. For now, many have forgotten about the bird flu. The panic was huge, and quite rightly so. If that virus, the H5N1 bird flu, had caused a pandemic, it had a higher virulence potential than the Spanish flu of 1918, which took a death toll of over 50 million lives, and higher than that of the current swine flu. The only difference is that swine flu can be transmitted from human to human, and bird flu can't, today at least.
How soon will it take for vaccination to become available?
The virus is already there. It's going to take about half a year to make an effective vaccine for it. For the next 6 months, while the new vaccine is not ready yet, I would recommend undergoing inoculation with existing commercial vaccines that contain the H1N1 component. Though it is different from the anti-gene point of view, it still might be useful, I think. Perhaps the fact that no deaths have been registered in the USA, where the percentage of commercial vaccine inoculated people is very high, proves just that.
Why is it that some people die from swine flu and others recover easily?
If I knew the answer to this question, I'd definitely win the Nobel Prize next year, if not this year. However, there is an explanation to this fact. We know that the high death rate has been observed in Mexico, but not a single death has been registered among patients in the United States. I believe the early detection of illness and its intensive and efficient treatment makes the difference. I believe the United States does it better than Mexico. Moreover, the US has detected mere several dozen cases of this illness, which they could treat individually. But Mexico has detected at least 1,500 patients, what actually means at least 150,000 people have been infected. Doctors cannot handle such a huge number of patients individually, and their level of medical care is obviously lower. But patients with severe forms of flu require intensive therapy treatment. They have to be placed in the intensive therapy wards where the qualified doctor crews can save their lives.
What do you advise people to do?
Molecular and genetic studies of the genome of this virus, as well as direct in vitro observations, show that the virus is resistant to the effect of an antivirus medicine called rimantadine. There will be no effect when using this treatment. As for another treatment, Tamiflu, the virus is vulnerable to it. With timely treatment, we think it is possible to reduce the acuteness of the symptoms.
Can anyone be immune to this virus?
Whether you're a Russian, an Arab or a Jew, you're equally vulnerable to the same diseases. But in countries with lower living standards and inferior healthcare, the epidemic is going to have a harder impact. For example, an outbreak of tuberculosis is indeed more likely in countries and populations where living standards are lower, with undernourishment, lower immunity and so on. In the case of flu, this doesn't apply.
How would you like the global community to address the problem?
It's like trying to invent a way to delay or prevent the eruption of a volcano or a tsunami, or to prevent an earthquake. The sooner we all, including those who make the decisions, realize that this is a natural disaster just like a hurricane or an earthquake, and there's nothing humans can do about it, the better. What we must do is try to predict such phenomena and do the best to mitigate the consequences.
Is Russia ready for a global pandemic if it may happen?
I'm confident, and that's the point of view of myself and many serious scientists around the world, that no quarantine measures have ever helped anyone to stop or prevent an epidemic anywhere. I already said that it's like a tsunami or a volcano eruption. Delaying it for a few hours or maybe a day is possible, but it's not preventable.
Professor Lvov, thank you so much for your time.